Is it true that mental health issues can arise from a lack of faith and spirituality?
Mental health issues are multifactorial. They can come from any one direction. It's important to understand that sometimes mental illnesses are biologically driven, meaning that they are something potentially hormonally, or there may be a neurotransmitter deficiency that is actually affecting the reasons why you have a mental illness. It could be also genetic, that you have a long family history of people in the family that say have anxiety or depression. Or it could also be environmental, something that's happening from the environment around you. Let's say, for example, you've lived your entire life without any mental health problems, but then, subhanAllah, you've experienced the trauma. It could be a personal trauma. It could be that you live in a country in which a war happened. You saw some very difficult things that you experienced. And so it's not biological or genetic, but it's something that happened to you environmentally, socially. Or it could be religious or spiritual, faith-based. You have a crisis of faith, or potentially a weakening of faith. Any one of these aspects could happen, and any overlap can also take place. When people say, you're depressed because you have a weakness of faith, this is inaccurate. I personally have known many people of strong faith, some of whom have been my own teachers in the Islamic sciences, who have an incredible amount of religious knowledge, an incredible ibadah or worship schedule, an incredible amount of faith. Yet, subhanAllah, their tribulation in life and their genetic history is that they've experienced a biological depression. The inability to get up and function every day out of bed, to get up and to go about your daily work, isn't because of laziness or a lack of faith in their case. It is something biologically, hormonally that they are dealing with, and it has actual treatments. So to judge them and to say, if you were to pray more, you would not have this depression is inaccurate. They are some of the people that have probably prayed the most in my life that I have met. Or if you have more faith or iman, this wouldn't come to you. This too is inaccurate. Could spirituality or religion be part of the story? Absolutely. Is it the only explanation? Absolutely not. And I think it's really important that we do not judge each other and have such amount of shame and guilt that we pile on when people deal with mental health conditions. Know that it's multifactorial, and know that to get to the bottom of it does require assessment to figure out why this is happening to you or your loved one.